This is video podcast 47 from LearningRadiology.com. Video flashcards, most commons in pediatric imaging, Part 2. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia. This podcast can be used as an audio-only, video-only, or a combined audio and video podcast. The way it works is that on side 1, there is a question, such as in what year did the War of 1812 begin? On side 2 is the answer, in this case, 1812. Let's get started. Musculoskeletal. What is the most common primary malignant bone tumor in a child? Pause your computer or MP3 player. Osteosarcoma. What is the most common tumor in the growing epiphysis? Chondroblastoma. What is the most common site of osteochondritis dissecans? The lateral surface of the medial femoral condyle of the knee. What is the most common fracture of the elbow? A supracondylar fracture of the humerus. What is the most common wrist fracture? A fracture of the distal radius. What is the most common type of Salter-Harris fracture? A Salter-Harris type 2. What is the most common location of a simple or unicameral bone cyst? The proximal humeral metaphysis. What is the most common type of tarsal coalition? A calcaneonavicular coalition. What is the most common joint affected by hemophilia? The knee. Of monostotic and polyostotic, which is the more common form of fibrous dysplasia? The monostotic form. What is the most common and least lethal of the Langerhans cell histiocytoses? Eosinophilic granuloma. What is the most common joint affected by septic arthritis? The hip joint. Genitourinary. What is the most common congenital anomaly of the urinary tract? Ureteropelvic junction obstruction. What is the most common renal fusion abnormality? A horseshoe kidney. What is the most common cause of an abdominal mass in the neonate? Hydronephrosis. What is the most common cause of hydronephrosis in neonates? Ureteropelvic junction obstruction. What is the most common renal malignancy in children? A Wilms tumor. What is the most common cause of a bladder tumor in children? A rhabdomyosarcoma. What is the most common cause of urethral obstruction in newborn males? Posterior urethral valves. In complete duplication, what is the most common site of insertion of the lower pole ureter? The urinary bladder, orthotopically. The upper pole usually inserts medial and caudally to the lower pole ureter. What is the most common site of neonatal adrenal hemorrhage? The right adrenal gland. What is the most common pediatric ovarian tumor? Benign teratomas, dermoids. What is the most common testicular malignancy associated with cryptorchidism? A seminoma. Neuroradiology. What is the most common site of intracranial hemorrhage in premature infants? The germinal matrix. What is the most common type of Arnold-Chiari malformation? A Chiari 2, which is almost always associated with myelomeningocele. What is the most common posterior fossa brain tumor in children? A cystic astrocytoma. What is the most common head and neck malignancy? A rhabdomyosarcoma. What is the most common suture to contain intersutural bones, Wormian bones? The lambdoid suture. What is the most common suture to fuse prematurely? The sagittal suture. What is the most common site of intracranial hamartomas in tuberous sclerosis? The walls of the lateral ventricles. What is the most common perinatal viral infection of the brain? Cytomegalovirus. And lastly, what is the most common site and side of an idiopathic scoliosis? A dextroscoliosis of the thoracic spine. Other most common podcasts include Podcast 15, Cardiac Most Commons, Podcast 21, Chest Most Commons, Podcast 25, GI Most Commons, Podcast 38, MSK Most Commons, Podcast 42, GU Most Commons, and the previous podcast, Podcast 46, Pediatric Most Commons, Part